Hello there and welcome to Clearview. On this platform, we receive complaints and go after those who can give solutions to clear the view. But you will discover that of late, we have not been treating many complaints because most of them are too domestic, too personal, or in court already, which makes such complaints untouchable. Our mainstay, therefore, is to attend to complex issues that are trending, issues that call for urgent and serious attention. Not so long ago, we treated corruption, cattle rustling, the Almajiri, Kogi political crisis, and more. This week, we are equally treating two issues of grave concern to Nigerians. The first one is on lifestyle, the issue of addiction, while the second one has to do with cervical cancer. To treat these issues are two women. Indeed, it's a women affair today. To handle addiction is a woman of many parts, Hadiza Aliko Mohammed. She understands addictions and vast in counseling. Hadiza is the CEO of the Recovery Place, a recovery and relapse prevention center for recovering addicts, mainly through the use of counseling and therapy. It provides an outpatient program to support addicts in their recovery using best practices and interaction through experience sharing and networking, creating awareness through talks in a bid to bring addiction out in the open to increase the spread of correct information and reduce denial and stigmatization. The first addiction conference was hosted in Kaduna in 2014. After this break, Hadiza shall be joining us. Welcome to the program.
Thank you very much for having me.
Now we know you are in charge of the House of Recovery, and that deals with issues of addiction. Exactly what is the meaning of addiction?
Well, to put it simply, addiction is when you are compelled to use or to do a certain action over and over again to the detriment, of yourself and the people around you. So even though it has a negative impact, but because of the compulsion to keep on doing it repeatedly, you cannot help it and it's not within your control. So that is, in essence, what addiction is.
What different types of addiction do we have?
There are many types of addictions, and the normal ones or the common ones that we know are, to alcohol and to cigarette. But we have others like addiction to food, to shopping, addiction to sex, to the internet as well.
Now, House of Recovery,
yes.
What is it about? Is it just to cancel, or are there some other things you do in the House of Recovery?
Okay, House of Recovery was started to look at or go into counseling to help people, to help in relapse prevention of addictions. But we collaborate with other workers, in this area to look at how we can also, educate people and try and prevent them from becoming addicts, rather than just only looking at those that are already addicted and helping them through counseling. So, our work is varied.
Right. Out of all ills, why did you choose addiction? Why are you so passionate about addiction?
Okay, I think addiction chose me, actually. I went into the field because I have people that I love that are addicts, active, users, as we call them. And I felt, if something should be done, but then we always think somebody somewhere is the person who you should shoulder that responsibility. And I felt, why not me? If these people are people that I love and that are close to me, then, I can do something to help. So this is what pushed me to go in and, read a bit about it and get certification to become, an addictions counselor and a general counselor as well.
You have some terms in House of Recovery. Alcoholic Anonymous AA and Narcotics Anonymous, and you have meetings over this. Can you break them down for us?
Okay, this is like a program for addicts where they come together, and they share their experiences amongst themselves, so that when they're sharing, those that are within that group can actually relate to the experiences that they have gone through. So this helps them to be able to deal with the issues in their lives. And within those groups, you find what you call a sponsor. This is an addict that is recovering, that is not an active user for a certain length of time, and then he takes under his wing an addict that has just started his road to recovery, so that if that addict at the beginning of the journey is looking for advice or is looking for support, his sponsor is there, to be able to help him and guide him through, those very tough areas of addiction recovery.
Who are your resource persons when you're having these meetings? Are you considering like imams or pastors?
No, unless they're addicts themselves. That group is just for the addicts and the recovering addicts. So if you come in there as a non-addict, you might not, that is the criteria that allows you to become part of this group. So it's not a preaching group, it's not a religious group, it is just a group that has, that all are addicts, and they sit down and talk to themselves frankly and share their own experiences to see how they can support and help each other. So it's not about preaching, it is, a group that is, non-judgmental, for addicts to come forward and talk to themselves and to admit, amongst themselves that these are their issues, and to see how they can get and support each other.
Good. Let's go to the basics now. What leads to addiction?
So many things lead to addiction, really. So many things. Your experiences in life, even your biological constitution. Some research has shown that there are certain people who are more prone to addictions because of, it is in their genes. And many people become addicted because they use substances or processes to help them cope with the situations they find themselves in. All of us have problems in life, Sometimes some people don't know how to deal with those problems, and they would rather, use a substance that will take their mind off the problems for that period of time. And once they start, they cannot stop, and then it becomes an addiction. So the causes could be so many things.
All right. You are into counseling. Do you have any program on prevention?
Yes, I think prevention is very, very important, because it helps, in even reducing the work. So as I said, we have collaborations with other NGOs where we go out and create an awareness about what addiction is, and how, people can get the information so that they'll be able to say no. So that they'll be able to have coping mechanisms in case there's a situation that comes up. They can, find other ways to cope with it rather than using any substance or using any process. So, prevention is very high, in the forefront of what it is that we're trying to do in collaboration with other NGOs.
Okay. Which government agencies are you relating with? Well,
we relate with the NDLEA. Because they are the agency, obviously, that is charged with the responsibility of drug law enforcement. And we have seen that a lot of, parents or caregivers that have, wards or children that are addicted actually approach the NDLEA to see if they can help in rehabilitating those children. So, this is also what it is that we do. Counseling helps you to be able to explore, your situation, to understand it, and then for you to learn how, to cope with what your problems are without having to fall back on drugs or processes.
What words of advice do you have for parents who have children suffering from addiction?
I think that is a very important question. I am a parent myself, and it scares me that, children are getting addicted as young as age 9. And even, in terms of substances, we have, substances within the home that we do not realize our children can become addicted. So it's not about locking them at home and not allowing them to go out. You have to educate those children for them to know what the dangers are. We have to talk about it. We have to, it shouldn't be a taboo anymore. And as parents, we should also be aware of what it is that our children are doing. We should be very present and in their lives to know exactly who it is that they're mixing with and what it is that they're doing. And another thing is, parents, we live vicariously through our children. What we didn't achieve as young people, we want to now put it on our children. There's so much pressure on them to become even better than we are, and those things can lead to a lot of high expectations, and if they don't meet up, those could also be issues. So parents, we have to step back and look at how we're parenting, the effective ways in which we would parent, so that our children get the benefit of our parenting, not that there's a negative impact on them because we're parenting wrongly.
All right, the last question I have for you now is not even a question. Let's imagine this is the house of recovery and you need to address some victims of addiction. Please go ahead.
I would like people to know, before I got into this field, most people think that you can control addiction. Most parents, that I've met, say to me that if he or she really wants to stop that, he or she can. But what we have to understand is that once you become an addict, you are not in control, and you need help, from those around you. And we've also seen that, addiction can be hereditary. Some of us are more prone to addiction than others. Just as people are diagnosed, with high blood pressure or with diabetes, there are people who are prone, to have a higher tendency of addiction. And if you look, within the family, you can see maybe there's that uncle that has always been a drunk. There's that, auntie that cannot, stop, smoking. We can look within our families and see if we have high incidences of people that are addicted to certain things. Even cola nut, Coca-Cola. There are people that I know who drink, 10, 11 bottles in a day. If you've become an addict, I think the role of judgment should be put aside. As a counselor, this is what I have learned, to put judgment aside and to give help to the person who needs that help. And we should be aware that there's a lot of denial, and this is because of stigmatization also. Nobody wants to come out and say, I am an addict, or I have an addict child or an addict brother, because we think it tells on us. But it is very important that we begin to talk about it, and we look at it openly. HIV was like this a long time ago, but because now it's out in the open and we talk about it, the stigmatization is much less. So if we can do that, bring it out in the open, accept that yes, we have this problem, then I think, collectively also we should, want to do something. Even if we're not parents, we're brothers, we're sisters, it could happen to anybody. So I think this is what I would say, that it's time, to step up and to help these people. And sometimes, it's better to also put that judgment aside.
Thank you very much.
Thank you.
We've been discussing issues surrounding addiction, and we had as our guest General Counselor from House of Recovery. Her name is Hadiza Aliko Mohammed. In the course of the program, we will be able to know more about meaning and types of addiction, why she has been so passionate about addiction, what leads to addiction, her program on prevention, and extensively she has advised the government, parents, the society, and of course the addicts. Among the female population in Nigeria, cervical cancer is the most common cancer. It has been reported that millions of women aged above 15 in Nigeria are at the risk of developing cervical cancer, with so many deaths. At our own level, we know that generally, cancer starts when cells in the body begin to grow out of control. Cells in nearly any part of the body can become cancer and can spread to other areas of the body. To join me in discussing this all-important matter is Onose Juliet Ohuahua. She is a medical scientist with a strong passion to eradicate ignorance and empower the grassroots areas with information to understand the menace of breast and cervical cancer. With this vision, she formed a non-governmental organization, the GRIP, that's the Grassroots Initiative Project, in the year 2010 to tackle the menace of breast and cervical cancer affecting our mothers and sisters, mostly in the rural areas. She has also formed a voice to speak out for teenagers in the society by organizing fora and book writings to reach out to every girl child. Onose Juliet has vowed not to rest until the cancer enemy is destroyed. Hope and care are the two words she lives for. Onose, welcome to Clearview.
Thank you very much.
Now, what exactly, in my own little way, I've been able to describe cervical cancer.
Yeah.
Now, exactly what is cervical cancer?
Cervical cancer is cancer of the cervix. Generally, cancer is when normal cells turn cancerous. So we're talking about cervical cancer now. It's cancer of the cervix. Cervix is the lower part of the uterus, just before the vagina.
Having explained what cervical cancer is all about, what are the causes?
Cervical cancer can be caused by HPV, human papilloma virus. It's a virus that affects the cervix. You have different strains of HPV, but the exact strains that actually cause cervical cancer is this 16 and 18. That's the major cause of cervical cancer. Yes.
All right. How do people now get cervical cancer?
Cervical cancer can be gotten through sexual intercourse, unprotected sexual intercourse. When you're having multiple sexual partner, it's a major risk of one getting cervical cancer. Another thing is the HPV actually causes the cells in the cervix to go abnormal. It causes abnormal cells to occur around the linings of the cervix. It's not like it's the major cause of the cancer, but it causes the cells there to change. So therefore, cancer could develop.
Will I be right again to ask you how people contact it?
Yes.
Through unprotected sex? Mainly?
Mainly is the major cause of the strains that can lead to cervical cancer. That's the 16 and 18.
Which other ways can one get cervical cancer?
Okay, one could get cervical cancer, maybe low immune system.
Okay.
Yes, because you can get the HPV, and if your immune system is high enough, it can just go out naturally. But if it's not, it could lead to cancerous cells. Long use of contraceptive too. Your partner's circumcision status is still another way one could get HPV. Yes, because when the male is uncircumcised, there's higher risks of HPV cells being attached to the epithelial cells there. So when the foreskin is removed, you have lower risks of having it if the partner is uncircumcised.
I see.
Yeah.
What then have been your interventions?
Okay, the group has actually done a lot in terms of breast and cervical cancer screening and awareness. We go to villages, rural areas to talk to them. We conduct screening process. We have to explain to those people how bad it is, because people don't understand. They just feel, okay, if it's not on the surface of the body, if it's not what you can see, they really can't tell. So how I don't understand why you would tell me I have to check inside my body when I can feed, I eat, I'm okay, because naturally, if this cervical cancer really does not have signs, initially it doesn't have signs and symptoms. It's when the cancer starts growing, that's when you start developing signs and symptoms. So people don't know they have to go for checkup. They don't know they have to do all that, because it's not a cancer that can make them start feeling sick instantly. You understand? So we try to tell them how important it is to go for the checkup, because if you don't go for checkup, you wouldn't even know you have the cervical cancer. So we've gone to a lot of rural areas. We've done a lot of screening and follow-up in terms of the cure.
All right. What are the symptoms?
Okay, symptoms of cervical cancer. Initially, as I said, you would not have any signs and symptoms. Only when this cancer starts growing, you could have symptoms like painful sexual intercourse, abnormal smell from the vagina, and you could have abnormal bleeding. When I say abnormal bleeding, I meant after menopause, you could still bleed, or during and after sexual intercourse, and in between your periods, you still start developing menstrual flow. It's abnormal. When your period has ended, you have some days after you start developing it, is abnormal. Some people have pelvic pain. Yeah. Okay. So those are the major signs and symptoms of cervical cancer. And when you start developing all that, it means it's turning into cancer. It's getting cancerous. So the most important thing to do is to go for checkup even before you start developing any of these signs and symptoms.
Yes. But unfortunately, one book I read revealed to me that in most cases, especially in Black Africa, women first of all approach analgesic. They quickly want to take some pain relieving tablets because of the pain, and in the process, the cancer is growing. All right. Do you have working relationship with hospitals and government?
Okay, the hospital I really have working relationship with, it's Central Hospital. I have in Benin, Edo State. Yeah, so when we go for screening, we check, when we find out anybody that is positive to HPV, I do the follow-up, I take them there, and there's a reduced cost for me for the treatment. Yes.
Okay, you don't have screening equipment. It's not as if you have your personal equipment that you use for patients.
No, I don't. But I always do a follow-up down to Central Hospital because the matrons there, it's very convenient when you hand it over. So the matrons there, they're always on ground. They do it perfectly and they do it well. So I have an understanding with them. I enjoy working with them, so I do that.
All right, so we're with Edo State First Lady, Ira Oshiomhole. What was the meeting about? That was done too long ago.
Yes, that was last week. It was about cervical cancer, how she planned to bring in medical doctors from the US to come and to do a massive crusade, an awareness program, and screening too on cervical cancer for the people of Edo State.
Is she trying to work together?
Yes, I'm working together with her in terms of the awareness. I'll be giving talk about the cervical cancer that very day. I'll have to go around, do campaign to enlighten the people about the program coming up and to tell them more about cervical cancer.
Where is your base and why the choice of that place?
Okay, it's actually in Esan West Local Government in Edo State, Ekpoma to be precise.
Ekpoma.
Yeah,
Why
I chose Ekpoma because of the rural dwellers. When you see them, they're so innocent, they're so pure, without knowledge, without information. So I see them as, I don't know, I need to harness them. I need to let them know. I need to talk to them about it because I feel people in the urban area, they have, at least to some extent, 50% of some information about these things. But those in the village, they don't have an idea at all. So I chose my base there because I can access them easily. I can talk to them well.
And they react well because, don't forget, in our villages, some might tell you that they have cure, they have some herbs that they can use. Have you ever come across such situations? Yes,
we have. It's not actually easy liaising with these women because they'll tell you, no, I'm not sick, nothing is wrong with me. No, and the screening, it's very awkward because they have to go naked. So some of the women they don't like it at all. But I'll have to go through the women head that can really understand their local dialect, that could talk to them, explain to them. I'll have to capture that one first, go through their king or any of the communities I visit, I go through their head. That will help me talk to the women. And it doesn't have to be on the market day, because if it's the market day, they will not respond.
Of course.
Yes, so we'll have to talk to them. And when you come, they don't have drugs to take. It's really a challenge. They feel, whenever you check me, you have to give me drugs. I need medicine. You understand? So that's really a major challenge. But with the help of God and the help of the head of the communities, the women there, the women head, I've been able to capture them. Yes, though it's not easy, but I try my best.
All right, before you allow you to go from here, we want you to send a word across to women in Nigeria.
Okay, I would like to tell everybody that unlike every other kind of cancer that could be inherited, cervical cancer isn't inherited, it's contacted. Please and please, you wouldn't know if you have cervical cancer unless you go for a screening test. I beg you, go to the hospital right now. You don't have to be scared. Just go there, tell them you go to any family healthcare center. Just tell them you want to conduct a cervical cancer screening, and they will assist you. Please and please, if you don't go for screening, you wouldn't know you have cervical cancer. Thank you.
All right, that will be all on this topic, cervical cancer, which has brought us to the end of the program, Clearview. And you will agree with me that Onose has done justice to the matter. Onose, thank you very much for coming to the program.
You're welcome, sir.
Next week is another date. I am Odion Bello. Bye for now.